Oh my god. 今天
Yeah, it's live now.
Okay. Sorry. Hi everyone. Oh yeah, I can see the live now. Yes. Hi everyone.
Zizi, you're very
Welcome.
excited today.
A little bit, yes. Well, I'm quite excited that we're coming into March now and we're still continuing with our webinar, which is
Yeah,
an achievement, honestly. Yes. So, welcome everyone to our webinar again. For yeah, we might wait for a couple of minutes for more people to join us. Meanwhile, we might talk a little bit more about our little Facebook page. Yeah. So, welcome to our page. This page is called Aphasia in Malaysia, which is a page where we talk a lot about aphasia. So we started organizing regular webinar early this year. So we talk a bit about what is aphasia and the communication strategies that we can use for people with aphasia. And today, well, I think most of our previous discussion focused a lot on like the population of people with stroke. And today we're going to cover another population, which is people with dementia. So I guess a lot of people didn't realize like that probably isn't like one of the like hallmark things about dementia. But people with dementia will also have language difficulties. At a certain stage, they will have aphasia, which Raymond will talk more about later on. So as I am not sure about everyone, but personally, I think I've seen more and more people with dementia nowadays. I don't really have access to statistics in Malaysia, but globally, there's 50 million people with dementia, which I think is quite a crazy number. And there are nearly 10 million new cases every year, according to the World Health Organization. So, definitely something that I think we'll see more and more, like what Raymond said just now, with our aging population and everything. So, I think it is a topic that a lot of people are interested in. I personally also interested to find out more about how to communicate effectively with people with aphasia. So, well, I rambled a lot of introduction without properly introducing us. Hi, I'm Zizi. I'm a speech language therapist, mostly working with adult population. And today, we're very happy to have Raymond again. Raymond is one of our regulars. Raymond is also a very experienced speech language pathologist working with a lot of adult population, so including people with dementia. And today he will share some tips about how to communicate effectively with them and also share some of the cases that have seen. So I am actually quite interested in a lot of the topics that he's gonna talk about. So I won't take up more of that. I'll pass the stage to Raymond to share this.
okay, thank you, Zizi, so much. Thank you, and thank you for all the audience to join us our webinar today. And I couldn't believe that our efforts still persist until today. So today we are going to talk
Yes.
about dementia, right? So dementia, lay terms we call it like forgetfulness in old people. Actually, we do have this kind of moment, like especially when you go out for work. Suddenly, when right after you started your car engine, then after that you suddenly forgot to bring something. Then you run up to your
Mm,
upstairs and then to get your things from your bedroom. But
okay.
do you ever experience that once you go into your bedroom, you suddenly forgot what you want to get?
Uh,
You see? So I
uh,
think
I I experienced that a bit too much. I can write a book with my forgetful experience, but
yes,
anyway, yes, I know that
yes,
feeling.
yeah, the forgetfulness is definitely normal in our daily life, okay? But for dementia people, this forgetfulness seems to be very, very serious to the extent that it disrupts their daily functioning. So that's why they need professional help to try to maximize their functions again. So today, I'm trying to share what I have been doing with my patient with dementia, and I hope to share a little bit of tips and strategies to help you to make them communicate. And sometimes they have even have chance to talk again to you. All right. So here is our slide. Okay. Uh, before we start the dementia, what is dementia? So let us just recap what is aphasia. Probably some of you come across our Facebook page. Once they come across aphasia, I don't know, like I just pass by. I don't want to like. Okay, so I think it's very important for us to recap again. What is aphasia? What is aphasia? So aphasia is a complex communication disorder. Normally, it is caused by stroke, brain injury, and dementia, which is our topic today. And it affects understanding, their talking, the reading and writing skills, and it affects one's ability to participate in social activities, and it might result in depression also. And the good news is for people with the aphasia, their intellect is intact, meaning they're still themselves. They're still the normal person. Only that they cannot use our so-called the earth language to communicate with you. That's all. All right. So what is dementia? So let me let the UK people talk to you. Okay, this is from the Alzheimer's Society from UK. So let them talk to you. What is the dementia? Okay.
What is dementia?
Sorry, I think the volume is a bit low. Let me adjust. Okay. All right.
What is dementia? Dementia is the name for a group of symptoms that commonly include problems with memory, thinking, problem solving, language, and perception in a person with dementia.
So let me stop this for a while. So as you can see, dementia is not a disease. It's just a set of symptoms that describe the difficulties in all these abilities: the memory, thinking, problem solving, language, and perception.
These symptoms are bad enough to affect daily life. Dementia is not a disease in its own right, and it is not a natural part of aging. Rather, the symptoms of dementia are caused by different diseases that affect the brain, including Alzheimer's disease. Dementia. What is dementia?
Sorry. So I want to stop here. So as you can hear from this video clip, dementia is not a natural part of aging. So as we can see, a lot of old people, they tend to be forgetful. They forgot where they put their keys, where they put their valuable belongings. But sometimes, if let's say the frequency is so much that you feel is something wrong with my mom, with my dad, then you might suspect if your loved one has dementia, then you might have to consult a doctor. And it's normally caused by Alzheimer's disease, and also it can be caused by the stroke. It can also be caused by Parkinson's disease.
The different diseases that affect the brain, including Alzheimer's disease. Dementia is caused by a loss of nerve cells. It is a progressive condition, meaning that symptoms gradually get worse.
Okay, so this dementia, if it's progressive, meaning if let's say they have lost a language in their dementia symptoms, so their language ability tend to get worse over time.
This is because when a nerve cell dies, it cannot usually be replaced. As more and more cells die, the brain starts to shrink. This can sometimes be seen in a brain scan of someone with dementia. These scans show a slice through the middle of the brain from the front, like looking through the middle of a stick of rock. They show what happens to the brain of someone with Alzheimer's disease as their dementia progresses over several years. Note how the black areas become larger. This is because the brain tissue, the grey areas, continues to shrink or atrophy.
Okay, sorry for interruption. So I think as you can see, okay, I want to move back to this. Sorry. I hope that there's some technical errors here.
These scans show a slice through the middle of the brain from the front, like looking through the middle of a stick of rock. They show what happens to the brain of someone with Alzheimer's disease as their dementia progresses over several years. Note how the black areas become larger. This is because the brain tissue, the grey areas, continues to shrink or atrophy as nerve cells die off. Common symptoms of dementia include problems with day-to-day memory, concentrating, organising and planning, as well as difficulties with language and visual perception, and changes in mood. However, each person will experience dementia differently, and the symptoms depend on the areas of the brain that are affected. For example, if cells in the temporal lobes start to die, that person might have difficulties with their language. Nerve cell death in the occipital lobes can cause problems with vision. There is currently no cure for dementia, and many of the diseases that cause it are terminal.
Okay.
Yeah. Oh, I was gonna say that some people like they might not be familiar with the term dementia, but like locally we also have a lot of like different terms for it, I guess. Like in Malay, I mean in Chinese, like the nicer one, not like nicer, I mean like the more common one would say like 失智症, right? And then in Cantonese maybe they'll say like 老眼青 or
Yes,
something
correct.
like that. Yes, yes.
Yeah, you're right. You're right. I'm so sorry about the technical issues. I hope that it doesn't disturb you, Zizi, just now.
No, that's all good. Yeah.
All right.
I
Okay.
forgot in Malay what is it called? Nyanyo, is it? Yeah. Sometimes they would say nyanyo
Yep.
for
Okay.
dementia, right? Yep.
Yep. Okay, so as you can see that from the video itself, so dementia is not the disease. First important thing. Second thing is if let's say they present the loss of language, so it tend to getting bad to worse. So this kind of aphasia, this kind of loss of language, we call it primary progressive aphasia. Okay, just for your knowledge. All right, you don't have to remember that. Okay, but just for your exposure. Okay, I think just a quick look about dementia communication features. So if you come across early stage dementia, so you will see that they have start to have word finding difficulties. So meaning they can't find the right word to say. They will say a lot of fillers. They have difficulties in recalling recent events. When they come to middle stage, you will see they have problems in maintaining a topic. Meaning, when you're talking to them, so they try to switch their topics from time to time. So until you're also like bang san already, you don't know where to follow them. Okay, and then they will use their language, inappropriate language, words. Like for example, they will use some swear words and some offensive terms. Or like for example, so sometimes they will tend to use BS, a lot of times, or
Yeah.
S word,
I think
F word,
it's like their social filter part is getting a bit weaker, so they are more direct sometimes.
Yes, exactly. And when it comes to the end stage, some of them they stop talking. You will see some of the dementia.
Oops.
They stop talking. They don't respond to you. They don't even produce any sounds. And sometimes some of them still able to talk, but most of the time they try to copy what you say only. Like for example, when you ask them what do you want to eat, then probably they will just follow you what you want to eat. Okay, something like that. All right, this is the main part of this presentation today. So hopefully I'm going to share with you some of the effective tips how to maximize the communication when we are coming across with people with dementia. Then at last, I will show you one of the case that I work with. So to see how effective these tips to maximize their communication. Okay, so strategy one. Okay, so today we are going to share with you 5 strategies only. 5 only, okay, not so much. First strategy. So JC, can you tell me, let you guess or let our audience guess also can. So what do you think this strategy is?
Um, I think it's like engagement in communication. Like in this picture, like they are looking at each other. They seem to be deeply connecting, I
Yeah.
suppose.
Yeah, you mentioned the two keywords. One is connected, and then second one is look at each other. Okay. So
Okay.
first strategy is maximize attention. I don't know. Some of you, do you still remember when was your last time you look at your parents' eyes properly, or look at our loved ones' eyes properly, or look at our friends' eyes properly when we're talking to them? Most of the time when we talk to our friends, talk to our loved ones, we tend to, busy with something else. Okay.
Yes.
So I think when you come across people with dementia, you will tend to use this kind of behavior when you're talking to them, but it's not going to work with them. Yeah, it's not going to work with them anymore. So what you need to do is you have to maximize their attention by how? You have to keep calling their names. So in the whole session of communication, so you might hear the names of the patient probably more than 50% of the time. Some family might feel that a bit awkward. Why should I call their names so often? But it is necessary for people with dementia because it's very difficult for them to focus their attention actually.
To
And
lock
sometimes,
their attention at you the whole time.
yes,
I'm
exactly.
calling you, I'm talking to you. Look at me.
Yeah, even now here through the Zoom, I have to keep calling your name, Zizi, so that I can start my question for you. This kind of thing. Yes, so that you can focus on my questions, right?
Okay.
There's sometimes some of the old people, even when you call their name, they don't want to acknowledge you. You see, because to them probably your calling is just noise only. Okay, so what you can do better is you can give them tactile, give them touch as necessary and appropriately. If let's say if this is your loved one, of course you can touch their shoulder, of course you can touch their arms. But if let's say it's somebody that you don't know as a stranger, then what you can do? Or your friends, probably you cannot just simply touch their shoulders. But before that, probably you can introduce yourself, shake their hands first. Then only probably you are more easily to what do you call that? Get into their personal space. Okay.
Yes.
And second one is eye contact. Again, eye contact. We have to really look at their eyes.
Okay.
Yeah. And third one is talk one at a time, meaning when you have conversation, when you're having conversation with people with dementia, make sure that only one person talking at a time and also one topic at a time.
Okay.
Yeah. All right. Thank you for your acknowledgement, Zizi. Okay. So second strategy. Let's see what is that. Okay. Ta-da! So Zizi, let you guess or let
Is
our
that a
audience.
quiz for me again?
Hopefully, our audience
Okay.
have any response.
So far no. Never mind, I'll take it
Okay.
first. I think this one looks pretty obvious. It's like make sure you're in a quiet environment without a lot of distractions, is it?
Okay. So what do you mean? What do you think this uncle wants to convey? What do you think this uncle trying to say? I think it's like shh is quiet, right? So I
Yeah.
think he doesn't have to talk. Through the photo, you already know what he wants to tell you. Then you
Or
can
is it about gestures?
yes, you get it right. Okay.
Oh, on the second try.
Yeah.
Okay.
Yeah. But unfortunately, I don't have any chocolates or any tokens for you.
It's fine.
Okay, you're right, Zizi. It's non-verbal communication. I think most, like especially in today's society and today's world, most of us save up a lot of time to talk to each other. So, what do you think we do to do the communication? I think one of them is very what do you call that? Very obvious and very significant is
Phone,
yes,
texting, social
texting.
media.
Yes, exactly. All these you don't have to talk. Okay.
Mm, mm.
All right. So of course here with people with dementia, you can't use the phone most of the time with them. Sometimes they will. You have to try other non-verbal communication. So what I mean here is facial expression. Like for example, here during this presentation, I don't know how many people looking at me. I'm like talking to an air, but I have to make sure that my facial expression is very obvious, so that it matches my speech, my presentation, so that it make the message very clear, so that our audience, when look back our video, you will understand our message clearer. Okay, our body language.
Yes.
Yeah, and gestures. So basically, what is the difference between body language and gesture? So gestures is more fine, of a more detailed kind of
I was
actions
gonna
like
ask.
this.
Yes.
Yes. So something like that, or pointing. Pointing sometimes can be, body language also. More detailed gestures, more examples of gesture. Like for example, you want to read a book, you want to eat, you want to drink, you want to sleep. Okay. So more specific kind of non-verbal communication, and body
Okay.
language. For example, pointing or the whole body facing. Whole body facing the
Okay.
entire
Yeah,
eye,
or like
right?
leaning forward towards
Yes,
somebody.
yes. Like show their interest in you. Okay. If let's say they instead of leaning forward, so probably they're sort of leaning backward, you see. So what do you think they show
Okay.
you? Okay.
They
Your
are like they want to keep a distance from me. Or maybe when they're like this.
or maybe yeah. Or maybe they say you're so boring. I don't want to listen to you. All right. And of course, intonation also play a very important role. We try to be like when you're asking questions, so you tend to raise your intonation. When you are talking like normal sentence, probably your intonation probably flatter kind of thing.
Yep.
Or sometimes if you want to highlight certain things, you want to raise your voice volume kind of thing.
Mm-hmm. Yep, sure.
And lastly, of course, you can use your phone, use your pictures and objects to help you to convey the message, to the
Yes.
person with dementia.
You
Yeah.
can do so many things with your phone.
Yes, exactly. Okay, let me show you this video to see what kind of nonverbal communication she's using to convey the message to you. You don't have to understand what she's trying to tell you, but just observe, see what kind of nonverbal communications. All right, let me. Okay, so Zizi, what do you think? What kind of nonverbal communication she's using? Or any?
Gestures.
Yes, exactly. Gestures. Okay, and now we have
Huh?
another example.
Okay.
All right. So, what kind of strategy they're using to communicate with the old lady?
Probably the like visual support, is it? What was the term that you used? Like they were looking at something in the computer. So like
Uh,
visual aid, or
yeah,
I don't know if
yeah,
it's visual or multimedia, something on the computer.
yeah, exactly. Okay, they're using the visual aid, definitely. Okay, now we practice. So hopefully we can see our audience to practice, but now we just practice for you. I mean, like how we use non-verbal communication to express the following sentences. For
Sure.
example, the first sentence: today is Sunday. Let's go to the shopping mall to buy some fish. If let's say you want to tell your loved one with dementia this
Uh-huh.
sentence, so you
Uh-huh.
cannot just say the sentence only. You have
Okay.
to use your non-verbal communication. So let's try
Okay.
using gestures to try to
Mhm.
convey this message. Okay,
Okay.
I have 3 sentences here, so later I will leave it to Zizi, the rest of the sentences.
Okay. Okay. Sure.
So this one I just demonstrate to you all first. Okay, today is
Uh-huh.
Sunday. Let's go to the shopping mall to buy some fish. You don't have to gesture each single word. It's going to be like a sign language. You don't have to be like gesture like this. Today is Sunday. Let's go to the shopping mall to buy some fish. So you don't have to gesture this way, and it make people more burning. Okay, you make people probably your loved one already
No.
already
More
fainted before you.
information to process.
Yes, exactly. So what you need to do is just gesture the keywords. Like for example, you can say, "Today is Sunday. Let's go to the shopping mall to buy some fish." So you just gesture 3 words. Today, let's go buy some fish. Okay.
Okay.
So it will enhance your clarity of your message to them. Okay. So now we go to the second sentence. I hope our audience is trying to do with us.
Yeah, this is a group activity.
Yes.
I wish we can see our audience though.
Okay, so if you want to talk to the person with dementia, so
Uh-huh.
this sentence, it's very hot. Shall we turn on our aircon?
Okay. Yes.
Okay.
Well, it's very hot, very hot. So maybe
Yes.
some sun or just very hot.
Yes.
If I have aircon at home, I'll point to it. But right
Yes.
now, I'll just
Yeah.
a remote like pretend to press.
Yes. You can pretend to press the aircon, or if let's say there's no aircon, within their visible, sight within their sight. So what you can do is you can say it's very hot. Let's turn on the aircon. Okay. You can do
Yes,
this way. Okay.
yes.
Okay, the last sentence. Okay, this is a very common sentence you want to ask them. It's lunchtime now. What do you want to eat? Do you want to eat?
Yes. So lunchtime or like if I have a clock, I'll point at it, then do you wanna eat?
Yeah. Yep. You're doing very good. Yeah, of course.
Thank you.
Very good, Zizi. So I think if you have the clock, you can point to the clock. But of course, if there is no clock, it's okay. So you can point to your waist watch. I mean the virtual one. If you don't have the watch, you just point the virtual one. You don't have to purposely wear your watch and point it. Okay.
Yeah.
All right.
Yes.
Okay. Now come to the strategy 3.
Uh-huh.
Okay. What do you think it is?
Uh
Our audience can also guess what kind of strategy for us to
okay.
use to communicate people with dementia.
Like the one thing at a time that you mentioned is like simple and bare, but just
Yes,
keep things simple.
yes, you're right. Okay, simple is the
Mm,
keyword. Sometimes we tend to talk too much to them. We try to explain everything to them. Sometimes our message still cannot get across to them. So what you need to do is you have to break up your sentences. You have to break up your instructions and ask simple questions like yes, no questions and give options. Sometimes some of the caregivers might feel that, why my mommy, why my daddy don't want to talk to me? I asked so many questions already. I try to simplify my question so and so, but my mom still cannot reply to me. My dad still cannot respond to me. So you can try this method. Okay, break up your questions, use yes and no question, and give options. So I will give you examples. Not to worry. It's hard to
okay.
imagine here. So what are the common mistakes done by the family and the caregivers is that they tend to give long instructions. For example, go to the bedroom and get a comb and get it to Shelly.
Mm-hmm.
Okay, very long instruction. And
Yes.
and you will ask them, what do you want to eat for breakfast? This is the common question you ask every morning. I believe a lot of family members will come across this. What do you want to eat for breakfast? They just look at you and don't give you any response. So once you serve them the food, then they push away the one. Then you were like, so you have to make again. So you try to make a lot of food, see what they want to eat. And then the other question is, where do you want to go? Like for example, if a person living, with dementia, they walk around and they walk around the toilet, pass by the toilet or walk around the dining hall or walk around the living hall. So you ask them, where do you want to go? This kind of thing. But seems most of the time they won't respond to you, I think. Okay, so what are the recommended ways? So for example, if you want to give a very long instructions, try to break them up. So you can say, go to the bedroom, complete the task if necessary, and then get the comb. Okay, and also complete the task, try to assist them to complete the task if necessary. Okay, what do you want to eat for breakfast? Just now we say we try to make it yes and no questions or options. You give options. So what you can do is, do you want an oatmeal or scrambled eggs? So they just have to answer oatmeal or scrambled eggs. Or you can change to yes or no questions, like, do you want scrambled eggs? Then they just have to answer yes or no. Okay, where do you want to go? So you can just straight away give them suggestions. Do you want to go Mid Valley? Okay, if necessary, you show them photo. But of course, going to Mid Valley probably not now, because now still CMCO. I think a lot of our our lovely old lady and old gentlemen, they're considered high risk population, so not recommended to go to the crowded area.
Definitely.
Yeah, so this is just example. I think you can straight away give them suggestions. Okay. All right. Okay. Second last strategy. So here I have this hourglass. So what do you think?
Something about time.
Yes,
Like
exactly.
give them more time, I would say.
Yep, you're right, Zizi. Give them more time instead of giving shorter time. I think nowadays, today's society, we tend to, like we say, talk a lot. We're not giving other people's chance to respond. Even with our friends, even with our parents. Even they don't have dementia. You see, I think this kind of behavior, if you develop, if you stay with you throughout your life. So this strategy is sort of like changing your lifestyle already. It's your ways of communication, so it's quite challenging. So what you need to do for giving time to respond, okay, first you have to wait for a few seconds before you help them to talk. Like for example, we take the breakfast example just now. That you say, do you want scrambled eggs or oatmeal? So you have to wait for a few seconds, like 4 or 5 seconds, for them to respond to you, instead of straight away change your questions or straight away help them to make decision.
Yeah.
And second technique is that you can rephrase your words. Like for example, if let's say your loved one is looking for their spectacles, when you say, "Are you looking for your spectacles?" They seems to be like seems to not understand you. Then what you can do is you can change your words. Like for example, you can change, "Are you looking for your eyeglasses?" or glasses, kind of thing. Okay, now let's go to the fifth, our last strategy today. Okay, let's see. What do you think it is?
Look.
Okay.
Look.
Yeah, they're trying to watch. They're trying to look at something. Okay. Yes, you're very good. So what do you think this strategy will help when we are communicating with people with dementia?
Well, if you will let them see like the object or picture, they can know, like there's something concrete that they know what you're talking about.
Yep. Okay, this is one of them. I think this one we already mentioned about that previously, right?
Yeah, true.
Yeah, actually, this is something else.
Okay.
Yeah, let's see.
Mm-hmm.
So listen and watch. Listen and watch. So you don't have to buy binoculars to watch and listen. Okay, you don't really have to. That one is just analogy. Okay, what do you want to watch? You have to watch their behaviors. You have to listen their behaviors. Okay, and also sometimes you have to look at their body language. Like for example, if an old man is walking around the dining hall or keep passing by the toilet, so you might think that, oh, is he what do you call that? Does he want to go to pee, or does he want to go to poo? Things like that. So you have to listen and watch their behaviors. Then what you are going to do after that? You have to work out the meaning with them. Okay, so you try to find out what they are trying to do, or what they're
Yes.
trying to say to you. All right.
Um,
Okay, here I have a video. So this video has no sound. So by
okay.
watching their behaviors and their body
Uh-huh.
language, let's see whether we can guess what she's feeling now. How is she feeling now?
Okay. Oh, we can let the audience guess with us too,
Yeah. The audience, please guess.
and comment your responses. Your guess.
Yeah.
Yeah. Okay. Let's see. What is this lady doing here?
Yeah. What do you think? By
Oh,
looking at
oh. I
yeah.
thought you will play the video, so this is it, is it?
Yeah, the video is done.
Okay. It looks like a picture.
Yeah, that's too
Okay.
quick. Okay, never mind. I will play that for you again. Okay.
Okay.
You have to really watch. Otherwise, you cannot really guess what she's doing. How is she feeling? Okay, the video is done. So it's just a
I
simple
cannot see
behavior.
any movement.
Yeah, but by looking at her body language, her facial
Uh-huh.
expression, you see,
Uh-huh.
does she look very happy?
No.
No. Okay, at least you feel that she's feeling uncomfortable. She's feeling sad. So
Yeah.
so she must be worrying something. You might think. She must be
Oh,
she
yeah.
might be feeling sad
Worry,
over something, right?
or
Then
like waiting for someone.
yep, or waiting for someone. Yes, you. So now, Zizi, you're on the right track right now. All right. So there's some. So that's why.
Oh, we
It's
also have audience commenting. I always say sad. Yeah, she definitely looks
yes.
sad.
Thanks, Elvis. Yeah, she's looking very sad. So yeah, like Zizi actually just now I play the video
Huh?
a lot of times already, right? So actually we tend to overlook their body language. You can't see how their feelings until we really highlight it. So this strategy actually very important and very
Uh-huh.
effective, and most of the time very difficult to
Ah,
practice. You
we have
see?
other comments too, like
Yep.
we slowly said alone, and then Lydia said bored.
Yes, sort of, yeah, kind of negative kind of feeling. Yeah, definitely. Yeah. So
Yeah.
by really watching their behaviors carefully, you really can get a lot of information so that you can start a proper conversation with them. Okay, now we look at the second video. Let's guess how is she feeling? She's not talking. Okay. So by looking at her body language, her gestures, what do you think she's trying to convey?
I think initially a bit confused, but after she like maybe a bit stressed about something.
Okay, so you say you feel stressed. So any audience, any comments from the floor? Let's see.
Let me check. Yeah.
Okay, confused. Somebody second your thoughts.
Okay.
Puzzle.
Thank you. I'm still loading the page.
Yeah,
Yeah. Yeah. In a deep thought. Yeah. I saw Lydia saying that.
yeah, it could be, so she's thinking of something, she's something she cannot get through in her mind, you see. So I think humor is very brilliant, it's very smart if we really focus on the every details in our surrounding and our loved ones, you definitely can come up with something. So especially the dementia people, so they will do a lot of all these non-verbal behaviors, the body language, because they cannot say already. So other system will be activated to enhance their intention to communicate. So try to practice this strategy. Listen and watch their behaviors and body language.
Yes.
Okay, so that's all for the 5 strategies. Let us recap. All
Okay,
right,
I was like,
that's 5 strategies. That's actually
yes,
quite enough for our caregivers to start practicing.
yes.
Once you practice, once you're very competent with all these 5 strategies already, let us know. We will talk a few more. Okay,
Okay,
but
okay,
I can tell you by practicing these 5 strategies is really, really more than enough to enhance the communication with them. Okay, later I'll
okay.
show you a case, the patient that I work with. It's really, really, all these tips are really, really powerful. Okay, let us recap our tips first. Okay, let's see the first
Okay,
tip. The first tip. Okay, anyone from the floor also can.
okay. Yes, yeah. I was like, otherwise this will be like a quiz for me. So I do remember. Let me see. I can't. Uh, Not yet. But this one I can tell. This is
Yep,
the maximize attention, right?
very good. Maximize attention. Second strategy.
This is the one that I will give the audience an opportunity.
Okay.
Yeah, so Mei Hui commented eye contact and engage. Oh, I
Yeah,
think
very
that was
good.
for the first one, yes.
Yes.
Um, yes. And
Yeah.
then this current one,
Yeah. Gestures. Lydia's is
yes,
right.
yes,
Okay.
correct.
Third one. This one, the audience must have been watching our video from start to until
Yeah, this one
now.
is a bit abstract and
Yeah, a bit
symbolic.
abstract. Yeah, a bit abstract, but it helps you to remember
Short
better.
and
You just
simple, yay. We should
oh
give
somebody
all this audience an award. 名字, is it? Yeah.
oh is it short as wow, you're very good, Mingzi. Okay, very good.
Mei
Yes,
Hui and Joey also.
yes, that's
Good job,
very good.
everyone.
Short and
Yay, this is my gesture for you.
good. Okay, fourth one.
Uh,
Hourglass.
okay, let me see.
Let's see anyone can guess it.
I'm so glad I don't have to do this quiz. um, yep, we're just waiting and see if someone. But this one is quite obvious.
Give time to respond. Yeah, Mei Hui is
Yeah, the same. Yeah,
correct. Mei Hui is
yeah,
correct.
applying the strategy, right? More time.
Yeah, more time. Okay, last one. I already show up here. Somebody using a binoculars, watching what? Try not to watching the other block. So watching what? Watching what?
uh,
Lydia said give longer time. Yes, for hourglass. I believe you
yes, yes.
are referring
My
that one.
God, all our audience deserve awards.
Yes. Okay. Listen and
Listen
watch.
and watch. Yes.
You're right. You're right. Listen and watch
Yeah.
what? Listen and watch the other block or the other
No.
handsome boy or pretty lady watching what? It's very important.
Mm.
Anyone? Watch what is very important. Or you just look at your loved one, just watch like that. So actually it's watching their behavior, watch their body language. Lydia, you're right. Okay. All right. Okay,
Yes.
okay, now we come to our quite the end of our presentation. Before I end the presentation, this is extra bonus for all the audience. This is one of the patients that I work with during the MCO period. Okay, so this lady, we call it M. She is 88 years old, a lovely mother of 5. I wish you to play some music. Can I? Okay, maybe probably I don't have
Yeah,
time
sure.
to
Sure,
maybe.
sure. Okay, okay.
I think we don't have time to explore this, so maybe next time we'll play some soft music.
Yeah, sure, sure.
I try to adjust my intonation when I'm presenting this. Okay, so
Okay,
this
okay.
lady M, she was diagnosed with dementia in her early 80s, and she's still able to communicate with family. Okay, first MCO start. Oh, thanks for the motorcycle for the sound effect. It's definitely really, really, really. This MCO
Timely.
really. Yeah, this
That's my
MCO
kampong.
really. really torturing us. So what happened during the MCO? I believe this is the challenges that a lot of family members come across during this MCO. Our mommy, my daddy, what happened during the MCO? The health deteriorates, dehydrated lung infection. So she lost her speech. She can't communicate anymore. Then after that, so CMCO. That's a good news. Why? Because the patients can attend face-to-face therapy sessions again, and we notice some bounce back of communication function. All right. Then second MCO again, second wave of our COVID-19. So the second MCO started. So basically, she tend to have less stimulation overall. She lost her speech again. And it's where I came across this patient. Sorry? Sorry, you are saying something, Zizi?
I was gonna ask, yeah, when you say she lost her speech, is it like, total loss of speech, she's not speaking, or just speaking less?
Yeah, for this lady M, she's not as responsive at all. Yeah, she just look at her daughter, so but she's not giving any response. She's not producing any voice. So she tend to choke on her own saliva. She has more difficulties in swallowing also. So yeah, this is very low level of communication. So she totally
probably like the end stage that you were talking just now, is it?
Yeah, probably the end stage of dementia. So you can see the MCO can really advance the level of dementia from middle stage to the end stage in probably just few months time. So it is when this is when I came across the daughter. She asked me to do online session. Honestly, I still trying to cope the style of doing online training.
Time to embrace online tele rehab.
Yeah, because for people with dementia, they cannot focus. Oh my God. So through the tele rehab, how can I engage with my patient, especially, patients with dementia? They're very hard to focus. Even when we are doing face-to-face session, it's very hard for them to focus on us. What's more if we do it online, right? So I think the caregiver is the key thing already. Surprisingly, we see some improvement after 8 weeks of online training. Oh, sorry. So we see she tends to be more alert, shows more awareness to surroundings, and able to communicate through gestures. And sometimes the daughter can hear some single words from her. And she started to have to demonstrate some decision making. Like, for example, she can choose the color of the dress she desires to wear.
Nice.
And the daughter sent me this feedback. This is a very long feedback she sent to me. I really appreciate that. Initially, I hope to record her voice, but she feels more comfortable, by writing it down so that more and more people can really read about that. So, and this daughter actually has learned the strategies that we have been sharing in today's presentation. So let's see what are the strategies the daughter has used. Actually, you don't have to use all 5 strategies. You just have to pick 1 or 2 strategy and use it consistently. I believe you will see the huge change in the communication with your loved one with dementia. So let's come back to the daughter. The first strategy she used, she keep making eye contact with the mother, the lady M. And she used facial and hand gestures when talking to her and explaining to her. She tried to use yes and no communication. And she drawing her back to alert state. Because most of the people, elderly with dementia, they are very difficult to focus their attention. So you can see their attentions keep fleeting and they keep looking away when you're talking to them. So it's very important for you to keep calling them back. Don't feel awkward doing this, but this is very important to sustain their attention. And over time, you will see that they can look at you even longer time. Okay, so your effort will definitely pays off over time. Okay. Okay, there is no secret. Okay, we already disclosed all the secrets how to enhance the communication with people with
Yes.
dementia. What you can do is only practice. Okay,
Yes.
and do not give up. Keep practicing by using the strategy, and you will definitely see the huge change, unexpected change. What change you can see, I cannot tell you because different person, different changes, different progress. But most of the time, my experience tells me that the changes will definitely very rewarding to the whole family. Okay, so I think that's all for my
Definitely.
presentation.
Thank you so much for Raymond for sharing with us. Very, very like
Whew.
it's like the essence of your therapy, right? I mean, like some people may think, it look very simple, sometimes even common sense, but it's really what is useful, based on experience. And thank you, Raymond, for condensing them and making them into such simple and easy to remember strategy. Then we also have questions from audience. I think just now I saw one from Risoli about I can't see it now actually, but I think
Oh,
it's about people with dementia.
I
Maybe
can show
sometimes,
you. I can
yeah,
show
when they
you.
exactly when they keep on asking the same question or keep on talking about the same topic. Well, that actually I have real life experience of it quite a lot. Like yeah, I've seen like patients with dementia or even like my own um grandparent would do that. Like when they forgot about it, they will keep on asking the same questions. And yeah, I would like to know what strategies can we use as well.
Yeah, I think this is the common signs and symptoms you can see. People with dementia that tend to repeat their early time stories, their early adulthood stories. A lot of times, even though you already answered them, you already talked about it with them, it's okay for them to repeat, and it's okay for you to keep. Probably you have to uh, continue answering them using a very patient, relaxed, and calm manner with them. Because I think the most important goal here is we have to keep their communication going, keep their interest in communication going. This is our ultimate goal. Try not to argue with them like, hey, this one already answered you. This one, why you so annoying? Or why I have to tell you
Mm,
so many times? But this is the nature of
mm,
dementia. They really can't help it. This is not their intention, I believe. So, I,
yeah, but like
yeah,
sometimes when it calls like when they ask the same questions more than
yeah,
5 times, sometimes you are also getting a bit impatient.
yeah, yeah.
Yeah,
So I think this is a good opportunities for as a caregiver, as a family member to train all these strategies to to really maximize their communication, because your ultimate goal is to keep the communication going. If you argue with them, stop asking this question, you already told me this for 100,000 times. So your anger will make them step back, so you make them lose their interest to communicate with you again in the future, I believe. Right?
yes, you all need to be more patient.
Yes, definitely. Okay. Wow, today we have a very long webinar. I'm so sorry about
Yeah.
that. Take up a lot of time.
No, no, that's you have so much to share. I believe you can share for another hour, but too bad we only have
Yeah,
an hour.
yeah, we can have part two in the future.
Yes, if there's interest, yeah, because I mean, I really like that you are sharing about like some real life cases, and it's very good to see like how your patients and the caregiver are applying the strategies, and to see that it's really working. So I think I hope it encourages all our audience, if you do have family members with dementia, to try and apply all these strategies and share with
Yeah.
us if it works.
I saw one question. Should we answer the last
Oh
question of
yes,
the day?
yes, sure.
Oh, okay. Oh,
Yeah, are you pulling it out?
yeah, yeah. Posting it out. Yeah. Can you see that?
Yes. So it's from Elvis asking about if the individual with dementia has no interest in therapy, should we continue encourage caregiver to provide simple cognitive tasks?
That
What do you
passes.
say?
Okay, so in my opinion, I think if there's no harm for you to carry on all these simple cognitive tasks, because your
Uh-huh.
goal for doing all these cognitive tasks is to maximize their attention, to sustain their attention, to keep their interest in daily life. Actually, you want to keep stimulating them. So as
Yeah,
long as the patient is interested in doing all the puzzle and sudoku that you know do with them, I mean, by all
yeah,
means, you just keep going.
yeah.
Yeah, and if
But
let's
I
say
would
they,
say,
yeah,
yeah, I would
I
say
mean,
interest is the key point. Like if they are interested, if it's meaningful for them, if they don't want to do and you just keep on pushing them to do, I think there's no point there.
yeah, exactly. If let's say they have no interest to go to the speech therapy, it's okay to give them some time off. You see, because sometimes for them, therapy could be very stressful. It's like a classroom setting. Unless your therapy session it's a very natural based setting, you have conversation with them, you do caregiver training in the session, probably might make some a little bit changes, but most of the time, patient might feel might feel very stressful when going to a therapy. I think it's okay to give them some time off, let the family members to practice this strategy, or you can just give caregiver training. How can they practice all this strategy in their home setting? Yeah.
Yeah.
All right.
All right. Do we have any other questions? Well, I think it is also almost time to wrap up. This is probably our longest session ever, but yeah, I mean, it's great to see that we have a lot to share and like we're getting a lot of interest as well.
Mm,
Well, that if there are more interests, we can definitely share more about this topic in the future.
yeah.
But yeah, really happy to see everyone joining our session and also engaging and asking questions, probably also sharing with us in the future. And a bit of what do you call it? Teaser? Like
Trailer.
we will yes, yeah, I
Not
don't
have the
yeah.
trailer.
Suddenly a bit of finding difficulties. So we are having another session end of the month, and this time we will talk about aphasia in acute stroke patient setting, right? So probably patients who just had stroke in the first 2 weeks or so, and what are the things that might be helpful, and we will have therapists working in acute setting to share with us about their experiences and some tips that might be helpful. So I hope you'll be interested in that, and we will post up the details soon as well. Yeah, but thank you so much to Raymond
Thank
today
you.
for
Thank
sharing
you.
with us such helpful
Thank
tips,
you.
spending time to preparing these and sharing your experiences. Really appreciate that. And for the audience as well, thank you for tuning in. And if you like our content, if you think like all these tips are very useful, please feel free to share this page with your friends and share the webinar with people you know and people who might benefit from it as well. So yeah, thank you very much. So thank you for joining us, and hopefully we'll grow together and learn together, and with a bigger audience soon.
Okay. Thank you. Bye bye.
Thank you, everyone. Bye.